How does recovery position prevent aspiration during epilepsy? Imagine witnessing someone having a seizure and knowing exactly what to do to keep them safe. One of the most important steps is placing them in the recovery position. This position is designed to protect their airway and prevent choking on saliva, mucus, or vomit that can happen during and after a seizure. When a person experiences a tonic-clonic seizure, their muscles lose control, and they often produce excess saliva or may vomit. Because they cannot swallow or protect their airway effectively during this time, fluids can enter the windpipe and reach the lungs, leading to aspiration. Aspiration can cause serious complications like pneumonia, which is why positioning matters so much. The recovery position involves gently turning the person onto their side, with their body supported so they won't roll back onto their stomach or onto their back. The person's lower arm is placed in front of them to support their head, and the top leg is bent at the knee to help stabilize the position. Tilting the head slightly back is a key part of this position because it keeps the airway open. This tilt prevents the tongue from falling back and blocking the airway, which can happen if the person is lying flat on their back. Lying on the side also allows fluids like saliva or vomit to drain out of the mouth rather than pooling in the throat. This drainage reduces the risk that these fluids will be inhaled into the lungs, which is a common cause of aspiration pneumonia. The position also helps keep the airway clear and makes breathing easier during the recovery phase. It stabilizes the body, preventing movements that could cause airway obstruction or increase the chance of choking. Medical guidelines from health authorities recommend placing a person in the recovery position as soon as the seizure stops, unless there is a suspected spinal injury or other specific contraindications. This simple step can significantly lower the risk of respiratory complications and help ensure the person's safety during the critical moments after a seizure. It is important to stay with the person until they are fully alert and breathing normally, and to seek emergency medical help if breathing difficulties continue or if there are other concerns. Remember, the recovery position is a vital first-aid measure that uses gravity and body positioning to keep the airway clear and prevent aspiration, supporting the person's safety until professional care can be provided.